interesting fact perhaps you did not know. South Florida has the highest number of people with epilepsy in the country.
Well, now doctors here are trying to find ways to diagnose and cure these patients faster. 7's Richard Lemus shows us a new high-tech lab with high-tech gadgets that's stopping seizures.
Where are you going?
Casey Fox has her hands full chasing around her active daughter.
Is that fun?
She's 15 months old. She loves to explore and play and get in everything she's not supposed to.
What makes caring for her little girl even tougher, Casey has epilepsy. The neurological disorder causes the new mom to suffer from seizures, something she worries could strike while she's alone with her child.
It's just scary to know that she could be, on the floor running around playing, and then all of a sudden mommy's not coherent at all, and mommy is not watching you, and mommy's not paying attention.
Whee!
For years, doctors didn't know much about what was causing Casey's condition, so all they could do was give her medications to try and control her seizures.
I've never been successfully medicated. Nothing has ever regulated the seizures.
We know that electrically she's having a seizure.
Now there's finally hope for patients like Casey. A new lab at Holy Cross Hospital is equipped with breakthrough technology to help diagnose and hopefully cure epilepsy.
A lot of people out there are said to have epilepsy and they don't, so making the right diagnosis.
Patients spend several days in one of the lab's private rooms with their head hooked up to these electrodes.
Kara, can you tell me how you're feeling right now?
Technicians in a control room watch them 24/7, while these video cameras and computers monitor and record their brainwave activity.
This way you can see exactly what's happening on the brain.
The idea? To catch a patient having a seizure so doctors can determine where the abnormality in the brain is located.
So if we're able to identify where those seizures are coming from, and the surgeon can go and remove that small piece of brain, we remove the area that triggers the seizure, and therefore we cure the epilepsy.
During her short stay at the lab, Casey had about 13 seizures.
This slowing is where the seizure starts.
But for the first time, she finally got the answers needed.
Well, they found out that my seizures are actually coming from my temporal lobe, my right temporal lobe.
Now Casey is scheduled to undergo brain surgery. It's a risk she's willing to take so she can focus all her attention on her little girl.
I want her to have her mother there for her 100%.
Doctors want to point out that all seizures are not caused by epilepsy. Some can be due to neurological or psychological problems. The test can actually help differentiate them. For more information, log on to our website and click on medical. In the Plex, Richard Lemus, 7 News.
Now.